Vitamins and minerals, calcium. This is the second portion of the slide presentations on calcium. In this slide presentation, we'll be focusing more on the functions and the mechanisms of action of calcium, in addition to the RDA and deficiency symptoms. We will now discuss the effect of calcium as a component of bone. So a very large proportion, so 99% of calcium is stored in our bones and teeth. So just to give a little bit more in terms of characteristics of bone, we have two different types of bone. One type, and this is makes up the most of our bone, is called cortical bone, and then we have trabecular bone. Cortical bone is the most compact form of bone. Again, it's about 80% of all of our bone, and it consists mostly of collagen, and it's present on the outer surface of bones versus on the inner portion of the bone. So that outer portion, that cortical portion of bone, is going to be the dense bone. And then we have trabecular bone, which is spongy, a more metabolically active bone, and this is going to be more porous and again more metabolically active bone on the inner portion of the bone site. Trabecular bone is going to be seen in higher percentages in what's called our axial skeleton. So the portion of our skeleton more central to our body, so our pelvis and our spine, versus our long bones like our arms and our legs, that's going to have primarily cortical bone. However, the trabecular bone we're going to see at higher content in our vertebrae of our spine and portions of our hip. Here's a diagram of bone. So we see the outer surface of bone being that cortical, compact bone, and you do see a difference in terms of visually and how it looks in terms of the porosity. So the trabecular bone you see as being more porous, whereas the compact cortical bone being more dense. So you can get a picture of that as well with this long bone, the outer portion being the cortical and the inner portion being the trabecular bone. So again, we have almost all calcium in the body being stored in the bone and teeth. That remaining 1% primarily is going to be circulating in the serum, so circulating in blood. And so calcium, along with phosphorus, makes up this compound called hydroxyapatite, made up of hydroxyl group, but then additionally the calcium and minerals and phosphorus. And so the hydroxyapatite is going to be this very key component of bone. We also see collagen being a component of bone, additional minerals, and then the main active cells in bone are called osteoblasts and osteoclasts. And when we talk about vitamin D, we'll talk more about osteoblasts and osteoclast activity. Osteoblasts are the cells that promote bone formation or the building of bone. Osteoclasts promote bone resorption or that demineralization of bone. We see additional functions of calcium. So we see calcium working actually with the vitamin K in processes of blood clotting. So it promotes clotting. It's a procoagulant. We see the role of calcium also with nerve conduction and muscle contraction. So we'll go over a few diagrams outlining the role of calcium in these processes again of nerve conduction and muscle contraction. Just a brief description here first before we look at the diagram. So we know with the process of nerve conduction, so when we have an action potential being sent through a neuron, so that action potential moves from through the axon to the nerve ending. And so what happens is that the action potential will increase permeability of the nerve ending to calcium. So as that nerve impulse is being sent through the neuron, again, it increases the permeability of the nerve endings to calcium. And then at that point, when the action potential reaches the nerve ending, the calcium enters the channels and triggers release of acetylcholine, which then leads to muscle contraction. So we're going to see that entering of calcium through the channels, the release of acetylcholine, and how that promotes the propagation of the nerve impulse from the neuron to the muscle fiber, promoting this muscle contraction. Here we see a neuromuscular junction, so we see the nerve ending, so this is the end of the neuron, and then we see the muscle fiber. So as that action potential moves through the neuron to the nerve ending, that again increases the permeability of these channels to calcium. So calcium is able to enter through these channels into the nerve ending, and the entering of the calcium promotes the release of acetylcholine. So you can see the acetylcholine in orange. The acetylcholine prior to this entry of calcium is stored within these vesicles. So the calcium entering the nerve ending promotes the release of the acetylcholine from these vesicles, and then you see acetylcholine within this this gap here between the neuron and the muscle fiber. And so the acetylcholine will bind to acetylcholine receptors on these channels, and these channels are sodium channels. So the sodium channels has these acetylcholine receptors. So when the acetylcholine binds to the acetylcholine receptors on the sodium channels, then that promotes the opening of these sodium channels, and then sodium is able to rush into the muscle fiber, promoting an action potential, so promoting a depolarization, and then with enough sodium we have an action potential that occurs, which after several additional steps promotes muscle contraction. So in addition to the role of calcium entering at the nerve ending, promoting the release of acetylcholine, there's an additional role of calcium in the process of muscle contraction. So we saw the activity at the membrane, so the outer membrane of the muscle fiber. So we saw how the sodium channels, you can see here the sodium channels open, sodium rushed into the cell. But we see that the activity of these are the filaments, the actin and the myosin filaments that are actually involved in muscle contraction are occurring or exist within the cell, so not the membrane of the cell, but actually more deep within the cell. So the action potential that first is existing on the membrane of the cell actually needs to be, that message of the action potential needs to be transported into the cell, and so calcium actually plays a role in sending that signal and actually having an effect on these filaments involved with muscle contraction. So at rest, we have calcium that is contained within what is called the sarcoplasmic reticulum. And the sarcoplasmic reticulum is deeper within the muscle fiber near the filaments, the actin and the myosin involved in muscle contraction. So we have the calcium contained within the sarcoplasmic reticulum. But after we have this depolarization and action potential of the muscle fiber, so once that depolarization occurs, the calcium is released from the sarcoplasmic reticulum. So the calcium is released from the sarcoplasmic reticulum and is actually able to interface with components of the actin and the myosin. So one of those components is called troponin, and troponin is a compound, it's a receptor that is actually on the actin, so the actin filament, which needs to interact with myosin, the other filament, for muscle contraction to occur. So calcium binds to this troponin, and then when calcium binds to troponin, then that allows for the actin and the myosin to interact, leading to a muscle contraction. So we're going to see that in more detail. So this is the actin filament, and at rest, the actin filament is not bound to the other filament called myosin. And the reason that the actin filament is not bound to myosin is because we see this protein called tropomyosin is actually covering, what are these little holes here? They're called myosin binding sites. So we see that the myosin binding sites are blocked at rest, and they're blocked because this protein tropomyosin is covering the myosin binding site. So actin and myosin cannot interact and muscle contraction cannot occur. But with the depolarization of the muscle fiber, we see calcium released from the sarcoplasmic reticulum can bind to troponin, and when calcium binds to troponin, that actually promotes the movement of tropomyosin. So calcium binds to troponin, tropomyosin moves out of the way, thus exposing these myosin binding sites. So at that point, after the calcium is bound to troponin, the tropomyosin moves out of the way, we have the myosin binding sites exposed, and then that can, with the involvement of ATP, lead to a muscle contraction. We see some additional roles of calcium. So here's a list of additional roles of calcium. So calcium on its own, or complexed with a protein called calmodulin. And so we'll see this diagram of calmodulin. So calmodulin is a structure that binds 4 calcium ions, and so it forms this calcium calmodulin complex, which has its own unique roles. So there's going to be some additional roles of calcium on its own or complex with calmodulin, and we'll see a list of them here. So activating protein kinase C, phospholipase A2. So we see that's involved with the formation of eicosanoids. We see that it's involved with myosin light chain kinase, which is involved with muscle contraction as well. And also it's involved in activating phosphorylase. Okay, so we have here the RDA. So the RDA for calcium for adults is 1,000 milligrams per day. We see those over 50, it will be a little bit higher at 1,200 milligrams. Adolescents, it will also be important to note that the recommended dietary allowance for adolescents is 1,300 milligrams per day. They're in a period of bone formation, and they should be accumulating significant bone mass at this time. So their RDA level is going to be higher, again at 1,300 milligrams per day, and that's for girls and boys during the adolescent years. We see the characteristics of excretion. So we see it primarily is being excreted in the urine, the feces, and in skin actually through sweat. And then lastly, we see the main deficiency symptom is going to be osteoporosis. So that's low body calcium will affect bone mass and increase the fragility of bone. So it's going to be excessive demineralization of bone and low bone mass if it's going to reach a certain cut point or meet a certain low criteria, that will be lead to the diagnosis of osteoporosis. However, low calcium status has also been associated with hypertension, so high blood pressure, and colon cancer. We see the tolerable upper intake level of calcium being 2,500 milligrams per day.